I'm all for gait analysis at appropriate times and for research and to understand what the
Mm-hmm.
body's gone through and what we need to work on,
Yep.
but it's not a first priority for me.
You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome back to the Active Mom Podcast. We have a returning guest, Celeste Goodson, who's been on the show previously. She's a coach and trainer for pregnant and postpartum elite athletes, and became one of my favorite people a couple years ago when she inadvertently put out a paper on common training drills that I have literally just spent so much time playing with in the sandbox and have had so much fun with. So I'm so happy to kind of talk to you about what you probably never intended about this paper and what I've played with. And I'm excited to know how you played with it too. So
Yes.
welcome back to the show.
Thank you, Carrie. Really excited to talk a little more in depth about it and what we've been doing the last few years. So thank you. Thanks for having me.
Yeah. So let's talk real quick about kind of just what you do historically, and then we'll dive into the study, and then we'll talk about kind of how we've played with it a little bit. So your background, tell us a little bit about, if people didn't listen to your first episode, who you are, what you do, and then we'll dive into the research.
Yes. So I'm a runner and have been a track coach for off and on 12 plus years, and studied exercise science, went into some cardiac rehab working for PTs for a little while. And then obviously, which what happens to most of us, we have kids and we get more interested in the pre-postnatal world. And I was just, at the time really shocked with how little progression was provided, or any progression provided for women postpartum. So got into training pregnant postpartum clients and then started my own online and in-home training clients early on, working with just this population, and then also designed a maternity support for pregnant runners, which kind of came from necessity also. So
Yes, that's the ReCORE Fitness Fit Splint, which
yeah.
I see everywhere on every single running moms group ever. When people are like, "What should I buy?" I'm like, "There's only one." And I wish it was invented back, because you kind of started work on that how long ago? Just for
Yeah,
reference sake.
it's been about, I have to think about my kids' ages, which helped me.
Right.
But it's been about 14 years, really.
Yeah,
But
because your kids are
just
how old
more,
now? Yeah. How old are
yeah.
your kids now?
So the oldest is 21 next week, and we have a 19-year-old almost, and everyone has summer birthdays. So coming up
Right.
on 21, 19, and 16. So our
Oh
youngest
my
is,
gosh.
yeah,
Oh my gosh. Oh, all
yeah.
right. You can give me the tips on how to survive high school, because I have one going into high school in the fall. So
Yeah, it's definitely a whirlwind. So hold on tight, and it
yeah.
does fly so fast. So
Yeah, no, I'm feeling that for sure. I'm feeling that for sure. All right, let's jump ahead here. And she's being modest too. She's worked with a lot of Olympic athletes and pro athletes and things like that too. And so yeah, she's being totally modest here. All right, let's dive into paper. So, external loading of common training drills, ranking drills to design progressive return to run programs. Where did you kind of decide, hey, because coming from a clinical standpoint, why did you decide to kind of start here and go after drills?
yeah, it was mostly because I couldn't find the information myself, and I was working with more elite athletes. They're trying to get back to competition. They're trying to get back to high impact. And you know, if you have any of them that are dealing with pelvic floor, C-section, prolapse, and it's sprinting, like particularly it was working with sprinters that brought this on, because they really do have to get back to a lot of these drills. I mean, marathon runners should be doing these drills too, but
Right.
Marathon runners is good at it, but the pro runners are out there trying to get back to these drills, and the sprinters are trying to get back to these high impact drills. And sprinting is just such a high load, high impact that the stress incontinence or prolapse symptoms might come on with that. So that's what drove me to really understand the ground reaction forces of these
Yep.
various drills, how they compare with each other, and how we can better program progressions for them.
All right, we did a quick location change, get a little bit better visual here, and I think it looks good. All right, so basically you were telling me a little bit about why you wanted to look at these drills, working with a lot more sprinters, things like that. So why kind of start with vertical reaction force? Like why is that something that popped into your head?
Mostly because the higher the vertical reaction force, the higher the impact, higher intra-abdominal pressure. And intra-abdominal pressure seems to be the biggest factor postpartum. It's
Mm-hmm.
also really important for any return to run program, any increased forces on the calf and the muscles and the Achilles. You want to gradually increase the demand. So it's a typical category to look at in a return
Yeah.
to run program.
Yeah. Now, this specific group of people that you looked at was not postpartum. Is that correct?
That's correct. We
Yeah.
did a general study. Half were female, half were male, mostly so people can feel like they can apply it to any return to run program. But
Yep.
there are definitely things we learned through the study that we can apply to the postpartum population
Yeah.
or
Yeah.
pregnant postpartum population.
Right. You're like, we just need something about drills, period, because there's nothing about drills at all. Yeah.
Right. Right.
So where did I think the list is like it's something
Mm.
like 47 or something. Like, how
Yeah.
did you decide which ones to do?
Yeah. We were taking low impact agility drills. You think of
Hmm.
ladder drills, agility drills. We were taking running drills, hill runs, stair runs, and some basic plyo drills. And how do they compare with each other? We already know from other studies what a typical easy run pace is
Hmm.
with, your, 2.5 times your body weight. We know that sprinting is anywhere from 4 to 5 times your body weight. We know like walking is like 1.5 times
Hmm.
your body weight. So it's where do these drills fall in between that? And we also have seen box jump studied quite a bit. We've seen
Yep.
some of the general plyo studied, but we did put a few in there, like jump rope,
Hmm.
and split jumps, that a typical plyo exercise that's used.
Yeah. So you compile the data, you pull it together. What, if any, surprises were you delighted by, disturbed by? Like what were your thoughts as far as what you found?
Yeah, the biggest surprise for me was how, for instance, a squat jump. You think of a
Yeah.
squat, prescribing that for someone postpartum, I wouldn't necessarily pick that as my first thing postpartum, but
Right.
it came really low impact because
Mm-hmm.
we had them jump really low off the ground first, and then we had them do like a big jump off the
Mm-hmm.
ground. And the low jump obviously was low impact, but
Yeah.
it is considered, gosh, should I be doing that
Right.
early postpartum? And the other thing to consider, and we do write about this in our end of the paper, we do want to still consider pelvic oscillations with postpartum clients. And
Mm-hmm.
pelvic or vertical oscillations, for people that don't know, it's how high is the body going, the pelvis. They can
Mm-hmm.
measure how high it's going. So the higher that pelvis rises, it is going to also increase intra-abdominal pressure.
Mm-hmm.
So, for instance, the things that surprise me the most are, a hill run. We broke our drills up into categories. So there was the low impact ones that were in category 1, and then a little higher category 2, then 3, then 4. And a
Mm-hmm.
lot of the running drills were 3 and 4.
Mm-hmm.
And the hill runs, which we know, we kind of already knew, we know hill running is less impact.
Mm-hmm.
And that's also very low pelvic oscillations, if you think about it. When
Right.
you're running uphill, there's not much pelvic oscillation. So in a way, when I'm working with a postpartum client and I'm considering some pelvic issues or prolapse or stress incontinence, I'm definitely going to consider something that is low impact and low pelvic oscillation.
Mm-hmm.
So that's what came out of the paper. It's not necessarily, yes, go ahead and go from 1 to 42
Right.
or exactly in that progression. That's what comes up for ground reaction forces. But like we said, we do really want to consider pelvic oscillations also. So I'm probably not going to put squat jump as my first low impact drill for a postpartum client, but it
Uh-huh.
can be somewhat early on, maybe,
Yeah.
not the first week, but maybe the second or the third week, they can do low, slow squat jumps to kind of introduce the pelvic floor to some intra-abdominal pressure.
Yeah. What would be the first thing that you might choose?
I definitely pick things like mountain climbers on the ground,
Mm-hmm.
which that's not even on here because that's
Mm-hmm.
not even standing.
Yep.
And these were all standing. So,
Yep.
bench mountain climbers or
Yep.
floor mountain climbers. And then very easy, like a line shuffle, one
Yep.
foot at a time or both feet. And like I said, it does depend on the client and their symptoms.
Yeah.
Someone may respond better to single leg versus double leg. So when you
Right.
assess them, you're looking at how does a hop feel? How does a jump feel?
Yep.
Because if someone is having pain on one side, it may
Mm-hmm.
be better to stick to, you know, double leg hops, not
Yeah.
single at first.
Yep.
So
No, you need to go do another study now and throw the mountain climbers in there because I'm like, yes, you're not vertical, but you're a little bit more flex. So what would that do? Like, I'm really like, now I want to know. So we're gonna have to. I'm making more work for you.
right,
Um, I
right.
love this, and again, I don't know at all if this is what you intended, but it gave me a starting point to be like, all right, if you think of the actual like average drills that the average person thinks about, they revert back to what they learned in high school, right? With high school track or soccer or whatever. And that's the part that made me kind of laugh the most because most of those drills, kick butts, high knees, all that stuff, they're all higher vertical impact. So if the average person, and I would dare say the average physio, because let's be honest, we all revert back to what we know. If they go to that as their first introduction to impact or pogos or things like that, like that's pretty
Right.
high impact, right?
Right. And it's pretty discouraging.
It's discouraging. And then here's the other thing. If you go back to the impact components in the return to run readiness screen, it's single leg hop, double leg hop, run in place. Those are all up there too. And so then what do you do? And I'm thinking of somebody I was DMing recently, and this is where I think people get stuck. If they don't know about your paper, and I've literally been trying to scream it from the rooftops, is okay, well, you get leakage with pogo jumps. We'll just go slower. I'm like, no, that's not always it. That's
Right.
slower sometimes is not better because you're kind of sinking into it and that's where again I think having a progression, lots of times I will run through it and then look for and how I use it. I'll just start with like 10 seconds just to see with each drill. And I'm looking for um things that connect between where people are having problems and where they aren't.
Right.
So is it unilateral? Is it when forward back or when you're going wide, are they having trouble with jumping jacks, things like that? Like what are the components in of that specific drill that you're having issues with? And then diving into more the musculoskeletal components of, well, why are you having a problem with that? And
Right.
that's where it's been like incredibly delightful because I have some people that like that very first squat jump, they're like, nope. I'm like, all right, we're even backing up to just bouncing in place. And then I have other people that they can bang right through no issues, but it's something completely different. And then I'm like, all right, well, we're good here. What else could it be? So it's allowed like a framework to just play and try and find connections and kind of pull pieces together, which again, probably wasn't your intention, but oh my God, it's been fun.
Yay, that's so great to hear. And I do love the term tools in the toolbox because as a coach or as a trainer, as a PT, when one thing's not working for your client, you
Right.
have, or patient, you have to have these other variations and modifications. And if you don't
Mm-hmm.
know any, you don't know what to give them or test them.
Right. Right.
Um, but when you have a lot to choose from and you understand, well, this is low impact category 1, this is low
Yeah.
pelvic oscillation. So if it's the pelvic oscillations that are bothering you, I know how to keep these low
Right.
for you. If it's, you know, if it's obviously you have to consider Achilles and calf issues too. I'm not going to give those clients hill runs. Like they
Right.
are not, we're going to have to take that one out. Even though it's good for a lot of postpartum runners,
Yeah.
you definitely have to have different variations and
Yep.
modifications available.
Yeah. No,
And
for
like
sure.
you said, because the low impact exercises that you can do fast, like maybe I can do mountain climbers fast. I can get those
Right.
muscles moving. I can get the start to get the pelvic floor to be more responsive quickly without having a lot of intra-abdominal pressure. So you start there,
Mm-hmm.
and then you know we're ideally wanting to get those muscles to respond quickly. So
Yeah. Yeah. Well, it's, I mean, even just stepping back, to like a 50,000 foot view, I don't know that unless you were specifically working with these elite athletes that you would previously have thought to incorporate drills. And I feel like the postpartum return to run guidelines was kind of like that first step of, okay, let's clear this out. But it wasn't a regular part of a postpartum program. And then
right.
jump ahead to, there's more talk about doing this in perimenopause and menopause. It's like, wow, we should have been incorporating drills a long time ago. When also every single postpartum mom, I know that first run that they go out and do, you feel like you're running through molasses.
Yes.
And, you want that gazelle feel. And God, it's hard. Well, just plowing through molasses is more and more times isn't going to make you lighter and quicker. You have to go back and be specific to that. And it was such a beautiful aha of, wow, we've been missing this whole chunk this whole time.
Right. The and postpartum runners are always going to feel really slow and heavy when they
Yeah.
first start running out. But the ones that have been able to do some of these low impact or quick low impact drills,
Mm-hmm.
they do feel a lot better on that first run. Their
Mm-hmm.
body's prepped, their pelvic floor responds a little better.
Yep.
It's ready. Running, even though it's easy running is about um, 2.5 times your body weight. Um, it's very consistent and very repetitive, and the pelvic floor gets tired. And so,
Yeah.
any prep work we can be doing
Yep.
for something that's a little higher but preps you for that running is going to benefit the runner.
Yeah. I think so too. The other thing I was really excited about was kind of looking at, I think again, stereotypically, if you're not in running world or pelvic health world, people think that running on an uphill incline is harder. I'm like, actually, especially for symptoms like prolapse, like we like that a little bit better. I prefer that to flat running because we get
Right.
that tiny little bit of lean. It's actually getting a little bit, ideally, we're assuming there's more automatic activation of a deeper core, pelvic floor, that sort of thing. But I think kind of seeing that in your progression too is like, aha, these things, this coincides with what I see clinically, which is a really nice thing to see too.
Right. It's true. Runners think of hill runs because they're just exhausting and cardiovascularly challenging, right?
Right.
Running uphill. But for someone who's injured or returning from postpartum, it feels so much
Mm-hmm.
better on the body because they're like, I can do this. And that's the other thing. Sometimes postpartum runners can feel discouraged because of maybe they tested running and it didn't go well, right?
Right.
Uh, that they still feel like they can get a workout with some of these plyo
Mm-hmm.
drills with variations. They can do something fast. They
Yep.
can, and they can, get their heart rate up um, when they're not ready to run yet.
Yeah. Yeah. No, definitely. So for you, as you're pulling this together, is this kind of a reflection of how your kind of programming for people was gravitating? Or did you find that what you learned changed kind of how you program for people and their needs?
It definitely helped me expand the return to running programming. I had a few that I would do, and it made me think twice about, um, where hill running would fall in
Mm-hmm.
a progression. It gave me a lot more confidence to give them a fast, low impact drill, maybe earlier
Yeah.
on. I mean, I knew it was low impact, but just seeing just how low it is, and there's low pelvic oscillation, it just gave
Mm-hmm.
me a lot more confidence to get more drills out there for the client. I mean,
Yep.
how many drills I was, what drill variations and what categories are really helpful. Like, I feel like I
Mm-hmm.
can, like you said, you can cover single leg, double leg. You can cover, hill runs. You can cover speed versus slow. You can
Mm-hmm.
choose if you're doing high pelvic oscillations or low, and how to gradually increase that. Like, you can hit all those categories,
Mm-hmm.
um, and gradually progress them. And I feel like I have a better understanding of the drills. Yeah.
Yeah. Are there any drills now that you wish you'd included? Or you're looking ahead and be like, we need a part
Like
two?
you, yeah, like you said, doing some, floor impact, like, mountain climbers.
Mm-hmm.
We just didn't include those because I figured they were going to be lower for sure anyways. But
Mm-hmm.
and then, yeah, maybe a few box jumps, but those box jumps can be so variable based on how high the box is.
Right.
Um, and uh, but if you look at a typical re- plyo box jump, which is maybe at least 20,
Yeah.
24 inches high, that's going to be probably going to be category 3 exercise at
Yeah.
least. But if you're doing a really low box jump to start with postpartum,
Mm-hmm.
which you can,
Yeah.
I feel confident that's probably falling in like a category 2.
Mm-hmm.
Um, and that's something they can do. Like, we don't, we can start really low and get them working on all the benefits that come from drills, right? We talk
Yeah.
about drills just in general for getting back to running and sprinting, but we know how important drills are in general just for bone
Right.
health and springiness and keeping this elasticity in the tendons.
Yep.
We should all be doing drills. So
I
it's
know. I know. Well, it's got I was going to say probably for your athletes that's very much a mainstay of their training and their programming. It probably feels really good to get back to something that familiar to them. Is that at all what
yeah,
you've experienced?
yeah, for sure. Because honestly, I have had soccer players, and sometimes they go back to their team and they're just doing some real basic stuff. Or they aren't even sure. The trainers there aren't really sure how to break down
No.
some of these drills for them.
Yep.
So it's when I get them, it's like, all right, well, we can do this lateral shuffle drill, and we can do this, and let's start you with
Mm-hmm.
this. And they're like, yes, I have stuff to do. I can do this. Like,
Right.
I see you know, see how this is going to progress, and they feel a lot
Yeah.
better.
Yeah. No, I feel like it's incredibly empowering because somehow I think we're still stuck in this, pulling away of movement and and I think that the tide is turning, especially, I mean, we've got, the postpartum guidelines from Canada that just came out. Like just I think we're getting some of that empowerment back, that movement is good and not, we're not necessarily harming, or drills aren't necessarily dangerous or things like that, but like we can grade it in such a way to be like, where's your entry point? Like everybody's going to have a different entry point. If yours is lower, then we just need to kind of work our way up, but you might start at a pretty high entry point and we can kind of pick up from there and still be okay.
Yeah.
Is that something you sort of experience as well?
Yeah, definitely. I feel like, um, if I'm getting someone very early postpartum, 2 or 3 weeks postpartum,
Yep.
I feel like the progression is honestly very similar, as long as there's no complications.
Right.
But it's true, if I'm getting someone 2 months or 4 months or 6 months,
Mm-hmm.
then I can be like, well, let's test this, and I'm going to
Yeah.
start you here, start you
Right.
here, and they're like, oh, this is great, I can do this, right? Like,
Yeah.
so I've been doing I've been afraid to do anything, right? So
Yeah.
definitely
No,
helpful.
that's nice to be able to, and people think, oh, well, what do you need with impact the first couple weeks postpartum? Well, anybody that's been up at 2 a.m. with a baby that you have to like bounce to get them to fall asleep or to settle down, that's, in my mind, that's like, yeah, we're thinking super low oscillations. It's not but like we're getting the brain primed to have some dynamic movement and some change in that oscillation that you're mentioning. Like that's very week 1, week 2 postpartum as far as I'm concerned.
Yeah. And I do think, something not everyone thinks about with postpartum or with doing low impact drills. It, I mean, I'd love to see more research on this, but
Yeah.
I do feel like the pelvic floor, because it was stretched through childbirth or just through pregnancy,
Yeah.
carrying that weight, it's stretched out a little bit. It's not as responsive. It doesn't, even if there's no big damage or anything, there
Mm-hmm.
isn't as much ability to move and stiffen against that pressure.
Yeah.
And when you start doing some of these really low impact drills, it it's not only helping the brain, it's helping, as you know, that pelvic floor wake up
Yeah.
and stiffen, like stiffen at the
Mm-hmm.
right time when that pressure comes down, like, um, and then it's like almost like, oh my gosh, these are really, really helpful for them. Like it's just so
That's,
helpful.
and I truly mean it when it's like, this has been like one of the things that's been most life altering in my practice is even just if I have somebody, how I've kind of approached doing some of these drills is I'll have them do a drill, and let's say, maybe they can't get to 10 seconds or something like that. And they'll have symptoms, and I'll say, okay, sit down. We'll have them sit down for like a full 30 seconds, minute, that sort of thing. And I'm like, I need you to try this again. And I have this experience, and usually the way that I've sort of teased it out, and I'd be curious if you experience this as well. The second time that they do the drill, one of three things is going to happen. It's either going to be worse right off the bat. To me, that says, okay, there's endurance, there's other things going on. Or sometimes they actually do better. So I'm like, that ain't endurance. That was deer in headlights the first time, and your brain didn't know what the frick was going on. And now we got a little bit sense of what's going on. Or it's the same. And I'll kind of explain that ahead of time because people automatically assume that if they only hit 10 seconds the first time, it's all strength, it's all endurance, and it's going to be less the second time. And they're shocked when they actually do better. And it's not everybody, it's a certain subset of people, which goes back to kind of teasing out the why. But like, I think there's such an importance in also repeating a drill when you're using it for assessment. Because if you just do it one and done and say, oh, well, you only can go to this. And I'm like, actually, like, I want graded exposure. Like, I want you to go to this and then sit down and rest and then try it again and see if you can go to that symptom threshold and then sit down again. But when you start to see it backtrack, okay, then we're definitely hitting an endurance threshold. I want you to call it at that point, but maybe we do 3 rounds. But like, if you only do one round of it, you're never going to get that piece of information. So it's not just the drill itself, but it's how you repeat it and the information you pull from it. Like that to me was like, that tells me a lot more about what's going on.
Yeah, I 100% agree with you on that. When I do test things with clients, even the drop test, I don't just
Yeah.
take the first one. The first one's not
Right.
going to be that great. They're learning the
No.
coordination, they're learning what you want them to do.
Yep.
So I do have them do it several times
Yep.
because part of it is a a coordination brain thing. What do you want me to do? Oh, you want me to do this? Okay. And
Mm-hmm.
then, and so for an impact test, right, you're absolutely correct. It may not be fatigue. It may just be like, oh, my brain just needed a second to catch up.
Yeah.
Now the brain's responding better the second time, and I
Yeah.
can do this, right?
Yep.
Yeah, for sure.
Yeah.
And
I'll
we
ex
all know, working with early postpartum
yeah.
and how slow the neural response is and how fast that comes back, that like,
Yes.
in a week, what they had trouble doing, sometimes 2 or 3 days later, they're doing it really well, right?
Yes.
Like they can generate stiffness, and
Yes.
or they can move their pelvic floor better, literally
Yep.
in the session, or within a couple days they're like, oh, I can hold my pelvic floor for like 4 seconds now. and
Yeah.
and it can come back fast for a lot of people.
Yeah, no, and I think again, having a progression, which I think for the average person, that's how they view success, is like, oh, I'm going to run through this progression of thing. I can do this now. I don't need to, I need to kind of do the next challenging thing. I think it makes sense for people, but it also allows us a way to gradually bring them back and then go back and retest. Okay, are you ready at this point? Are you clearing your readiness screening? Are you, let's go back and try and do the thing that was symptomatic for you before. And that to me has been where I've really kind of stuck with this is I'll have them work on drills and then go back to the thing that gave them a problem in the first place, and we're better. And
Yeah.
and this is where I turned to all my smart research friends, and I was like, okay, I don't know what I'm doing. Like, I don't know the physiological. I can make some assumptions and kind of explain it off. I don't know whether that's actually true or not, but I'm getting people better using this kind of progression, and we're getting there faster than not. And I did a an interview with Linda McLean last year, who's at the MFM labs, and she was delightful. And she's like, you know what, you can still kind of keep doing these things and not know the answers, and it doesn't mean that your results are, for naught. Like, keep going, we'll figure out the stuff later. But that's where I would love to know, because in my head I'm like, okay, you tested, reaction forces. Is it really that, or is it something else? And on one hand I want to know, but on the other hand I'm like, I don't care. Because I'm like, this progression in a good number of people works, if I use it at the right time. Where it drives me nuts is if I'll run somebody through and I do occasionally I'll get that patient where I'm like, no, we're good here, you're still having problems. I don't know, like, what to tease you through. So that's where I think it is important to kind of figure out what it is, that we're looking at, and what those factors are. But to kind of
Yeah,
go, yeah, go ahead.
I was just going to say, yeah, some of these exercises are hard to compare and control with people, and
Right.
like you said, you have to go with what you see working sometimes, because the research may take a while to
Mhm.
be able to figure out how to test that control.
Right.
Especially things like the drop test, people can do it different. Intra-abdominal pressure is definitely a factor, but it's a very hard thing to control and test. So
Yeah.
yeah.
Yeah. No, and I was talking to Grania Donnelly earlier. I don't know if you saw the paper that just came out. It was association between symptoms of pelvic floor dysfunction, running kinetics, and pelvic acceleration, and they didn't find a connection. And I was like, well, there's got to be something. And we talked a lot about kind of what were potential things that they might change in the study, or kind of what they're looking at and things like that. But like, I think, as to your point, like, as they catch up with looking at what we think we're looking at, like, we still know that these progressions, there's validity to it. We're getting improvements. We just got to figure out why we're
Yeah.
getting them and what it is that we're doing.
Yeah.
Um, for you, let's just go back even like the last couple of years since that paper came out. Um, what are some of the things that you're finding that you're kind of doing differently with your clients, even just in the past couple of years?
I would say I've just expanded. I have them doing more drills than I used to.
Mm-hmm.
I have them kind of hitting all the categories, unless there's an
Yeah.
injury that I would need to take one of those categories out. So categories meaning single leg, double leg, um, you know, low to high pelvic oscillations, slow to fast speed, and then
Mm-hmm.
lower ground reaction forces to higher ground reaction forces. Trying to hit all of those things and
Mm,
increasing intra-abdominal pressure. That's also a little subjective, like I said, because we don't have all the data on
right.
that.
Right.
We do know some that are higher pressure than others generally, but gradually increasing intra-abdominal pressure. So I'm hitting every single one of those categories to help them be able to do everything, right? Get back to the
Yeah.
high impact drills and the longer running, and as long as there's no complications. And if we have to take one of those out for a little while and then you go back
Mm-hmm.
to it, then that's fine. Yeah.
Yeah. No, and I think again that's the beauty of it. Again, it's just kind of having a framework to be like, all right, I need a little bit of this, a little bit of this. They might be able to go faster in some areas, and others we might need to kind of be a little bit more intentional and slower and methodic to as they're kind of, especially if they're symptomatic, prolapse, leakage, those sorts of things for sure. Um, for you, like what might be like if you have somebody that they're navigating prolapse symptoms early on, where might be a place that you start with them from a drill perspective, and what might that progression look like, understanding
Yeah.
obviously everybody's different.
Yeah. I do have a few favorite ones um, that help get the muscles moving quickly, responsive, but
Mm-hmm.
they're really not any impact at all. Like if they're laying, I think in a bridge position, but they put their feet on a gym ball.
Mm-hmm.
Sometimes I'm putting two weights on it so it stays in place.
Mm-hmm.
If they're by themselves, and they can be doing like heel kicks on it, and they're just
Mm.
quickly. They're getting the
Mm-hmm.
legs moving quickly. Um, Working the hamstrings, working the core,
Yeah.
but feeling like they're getting the sprint mechanics without
Yeah.
the impact
Yeah.
yet, or without the prolapse, the intra-abdominal pressure yet.
Yep.
Um, I obviously bench, incline, that type of thing.
Mm-hmm.
So, not standing up, but we're just lowering a little bit. So obviously mountain climbers are great to start at, and
Mm-hmm.
then bench. And if they have to stay there a little while, then that's fine.
Mm-hmm.
Um, I'm trying to think if I have a few other ones. Even sitting and doing the hamstring kicks against the ball.
Mm-hmm.
Um, you're in a sitting position, so a little more gravity, a little more intra-abdominal pressure, but we're
Yep.
still not standing. So that's helping wake those muscles up.
Yeah. And I like those because it's very different from like the stereotypical pelvic floor training. It's like we're recognizing we're going into a dynamic activity. We're training that dynamic aspect of muscle contractions. Like I had somebody DM me the other day that she was stuck in an algorithm where you pre-contracted before every single rep, or there's still people out there telling you to pre-contract your pelvic floor before your foot hits the ground when you run, which I'm like, show me how you do that. But in a situation, the drills that you're kind of talking about, like you're deferring to the automaticity of the pelvic floor to be like, hey, I'm going to give you an activity, this stimulus, have you try and respond, have you adapt, like have you try and, navigate this. You cannot consciously do it that fast. The only way you can do it is to rely on the automaticity. I don't know where people still think
Right.
like it's
Right.
2025. Why are we still doing that?
Right. And I do think, and I'm sure you agree with me on this, I do think that there's a place for early on
Yeah.
isolation. And I think it's important to get full range of motion and be able to
Yeah.
control, do those things. If you're not able to do that, the fast drills, you may not be getting much pelvic floor recruitment yet, and it may take
Right.
longer. So I definitely like to see that they can isolate it first, get full range of motion,
Yep.
get some sort of hold. But yeah, then yeah, it's like let's start getting the brain
Yeah.
doing this automatic,
Yep.
and there's so many different ways to do that
Yep.
without causing pelvic floor symptoms.
Yeah, exactly. And again, like it's just so much more kind of, I hate to use the word functional, but it is, but like historically, you know, we would be like, we'll do a bunch of quick flicks. I'm like, that's still not the same thing. They're like, oh, it's a
Right.
fast twitch muscle fiber type. I'm like, is it really? Like, is it?
Right.
um,
Yeah.
but yeah, I love that it's this less pelvic floor centric approach, which I think a lot of us kind of are trying to evolve. Kind of as we shift more to like the pelvic floor just being a muscle as opposed to be this weird dark place sort of thing.
Right.
Um, so from there, like it sounds like even like the subcategories there. I love the starting in that bridge position because sometimes pelvis up with prolapse is a little bit more comfortable position, and
Mhm.
then starting to shift and get more vertical. Is that kind of one of the what are sort of the variables I guess that you're thinking of? And I'm assuming coming up into vertical is going to be one of them.
Yep, definitely. That prolapse feels better in that
Yep.
position where the legs are higher up, right? And
Mm-hmm.
it's kind of gravity's not going against you. So it's kind of feeling like the organs and everything's in place like you want it,
Mm-hmm.
and you feel like you can move and start getting the muscles moving quickly or responding
Yep.
quickly. Yeah, definitely. That's exactly why.
Yeah, I like that. It's fun. There was a paper, I think Lori Forner did it a couple, time has no meaning. Maybe it was last year, year before, where I think they did like a legs up the wall or a elevated pelvis position and looked to see if there was anything different physiologically, and there wasn't. And I was
Mhm.
like, but Lori, did the symptoms change? And she's like, we didn't ask that. I was like, next study.
Yeah.
Next study. She's like, we're just looking to see if things are moving. I'm like, great, they weren't. I want to know how they felt.
Yeah. I mean, we know they're not going to feel the pressure in that
Yeah.
position.
Yeah.
They're really only going to feel the pressure sitting,
Yeah.
standing, more impact.
Yep.
I mean,
Yeah.
there will be some pressure from it, but
Mhm.
obviously just not always in that direction.
Yeah. No, I think very, very historically and clinically, like that's always been kind of like a quote safe or like a recovery position for people. So to start there and introduce some dynamic movement and like some impacty oscillation-y sorts of things, like that's brilliant. Where might you progress from there? Like is there any like when would you make a jump to that first like mini squat jump?
Yeah, I would say I typically would start in that bridge position, and then the next week maybe they're standing but doing slow marches.
Hmm.
Um, and then uh, the mountain climbers can definitely be maybe that same week
Yep.
as the bridge position, but maybe it's the
Hmm.
next week. Then we're doing the slow standing marches. A
Yep.
lot of times I like to just put, I mean, just because of a running sprint drill person, I like them to have their hands over their heads so they're keeping it upright.
Yeah.
Easy way to get a good sprint mechanic position, but then
Hmm.
they are like just slowly feeling like, okay, I'm going to hit the ground a little harder, hit the ground a little harder, because
Hmm.
we know the harder you hit the ground, and which is what a sprinter is doing when they are
Right.
going full speed, they are hitting that ground really, really hard,
Yeah.
generating a lot of, and they want to feel confident when I hit that ground that my pelvic floor is responding. But so
Yeah.
we just hit slow, but you're not really getting off the ground. Um,
Right.
the slow march, that's what I like.
Yeah.
I like. Yeah.
Backtrack a second. I just want to get a little bit more of your thoughts on me not ever having been a sprinter. Talk to me about the importance of doing that overhead, kind of like some sort of overhead activity combined with that. Where does that come from? Kind of what's the concept behind that?
So working with sprinters versus distance runners, which it kind of
Mm-hmm.
cuts off around the, technically, if you've got a pro runner athlete that's like running a 400 or less, 400,
Yeah.
200, 100, they're technically considered a sprinter. And just because of, the anaerobic capacity of that distance, but
Mm-hmm.
they need more front side running mechanics.
Yeah.
And they're able to hit the ground harder in those
Mm-hmm.
positions, get themselves propelled forward. So
Mm-hmm.
putting the arms overhead puts their body in a front side mechanic running position.
Mm-hmm.
Um, and then it's just helping them hit underneath themselves, right? So
Got it.
in general, we want runners to land underneath, maybe
Yeah.
underneath, maybe slightly in front, right?
Hmm.
We know it doesn't matter if it's a heel. We don't know matter if it's
Yeah.
midfoot,
Don't care.
but we want them landing close to center of mass. And so
Hmm.
when someone puts their hands over their heads and they start doing marches, they're generally going to do a good job of hitting better
Mm.
in the right spot and staying upright,
Yep.
And that's also one of the things that's hard for me, working with distance versus sprinters. You know, distance, easy running. Yes, there is that slight like ankle lean from the
Hmm.
ankles a little bit, but I don't, I honestly don't like to cue a lean unless they obviously look like they are leaning back, because
Yeah. Hmm.
people can be running upright, and maybe it doesn't look like a lean, but they land close to center of mass. Like there's no reason to tell them that they need to lean.
Yeah.
And sometimes if you tell a runner to lean, they lean too much. They
It's like a
aren't.
weird, yeah.
So I
Yeah.
feel
No,
like to cue that unless it's obviously too far back. Because most people, there are runners, you will look at any pro runner,
uh-huh.
high school runner, college runner, they can look upright, they can look
Well, I'm,
slightly, but they're
yeah.
really close to center mass and doesn't really matter.
The one I'm
Um,
thinking of, Kira D'Amato, is so upright. It's not even funny. Like like you can see her, you know, it's her from a mile away, but just because she's so upright. And I'm like, clearly you can. And again, I use these pro marathoners. Like, there's so many different formats. Helen Obiri,
yeah.
like all over the place, and clearly she's doing fine. You know.
And a lot of it does come from, I think if they generally did more sprints growing up and then they kind of
Yeah.
gradually go at the distance, they tend to be more of an upright runner.
Yep.
They did a lot of those sprint drills. And it's true, the faster you go, the more upright you will need to be.
Mm-hmm.
So, I mean, and when I say lean, I don't even like saying that because you're really not leaning. It's just
No,
a
it's not
slight,
much. Yep.
slight relaxation in your posture.
Yeah.
But runners, it varies. And so when you're
Yeah.
working with a distance runner and they're getting faster, they
Mm-hmm.
should look more upright. Like if they're
Yeah.
starting sprint drills or doing strides, they should be
Yep.
running more upright. It just helps them hit the ground better and faster
Yeah.
and with more force. So, yeah, it's flexible.
Yeah. No, I want to come back to that for a second, but I want to circle back to just the overhead work. I used to hate um like overhead lifting days, and the gym that I go to, I can only go 2 days a week. And so like right now I'm stuck in a cycle where, and I mean this lovingly, like the days that I can go, one is like bench day and now we're doing push press. And I'm like, runner hating upper body days. But I
Mhm.
have come to realize how much kind of core work is involved doing overhead and like making sure my alignment's in check and I'm stable in order to get up in these higher weights and like do a dip and a drive and those sorts of things to get my hips like to be able to get in that dip and hold that load. And I have become a convert. Not being a sprinter, I do, I think now see much more the benefit of doing overhead work, and especially postpartum when we're trying to refine that, that stability. I am embracing it. I am trying.
That's awesome. It really is a good point. It also does help activate the core, and it
Yeah.
also helps just strengthen the core, because
Yes.
we also
Yep.
know another reason I hate sometimes the lean cue if they don't need it.
Yeah.
Runners will lean more when they're fatigued and tired,
Yep.
because
Exactly. Yep.
their core is done
Mm-hmm.
and their body's done, and this is about all I can hold up. So there is
Yeah.
too much lean, there's fatigue lean, and and that can make you not run as efficient. So core is helpful and important, and like I
Mm-hmm.
said, overhead really does help with that as well.
Yeah. The point I wanted to make earlier was, yes, there's these nuances to playing with running technique. And I think if you have been in this space and understand those nuances, and I think we hesitate to start there because we know there's a lot of better places to start. And we know that, a lot of different people can have a lot of different ways to run and things like that. I'm seeing, I don't know if you're seeing this as well, with a lot more people kind of playing in this space and working with runners that may not have that background, that one of the first things that they want to do is change your cadence, add that lean, play with all these things that I don't want to touch until I have to. Like, are you running into that?
Yeah,
Okay.
yes, 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 yes.
Do tell.
First of all, we know their gait's not going to look super great early
Mm,
postpartum. They're weaker. Their core's a little weaker. They're trying to get the muscle coordination. I'm not worried about their gait mechanics early postpartum.
mm-mm.
I'm just focusing on strength and responsiveness and pelvic floor. It's going to come, and the gait is reflective of them going through pregnancy and postpartum.
Yeah,
It's
very
a
much.
little wonky. I do think the research is important, and it's important to see how different the gait is because it tells you what's happened to the body and why it's so important to do rehab postpartum. So I'm all for gait analysis at appropriate times and for research and to understand what the
Mm-hmm.
body's gone through and what we need to work on.
Yep.
But it's not a first priority for me to be
Mm-mm.
focused on that because all these other things are going to help that improve.
Mm-hmm.
And yes, you can hyper focus on that and miss what they really need to be working on.
Right.
Um, and like I said, we know the gaits. Rita's done great work with this. Shafali's done great work. They look at these gait mechanics and they see just how different you run because the body's been
Mm-hmm.
through so much. And
Mm-hmm.
more reason why we need standard rehab,
Right.
for these postpartum athletes and runners and things, just postpartum in general. But
Yeah.
yes, 100% agree. And then there's people are throwing out track cues and running cues that maybe don't have a running education background on biomechanics or working with athletes, and they're just
Mm-hmm.
confusing them. And
Mm-hmm.
it's hard. It is hard.
You have feelings. I love it. Um, yeah, if you're listening and not watching on YouTube, we have feelings. No, and I think it's an oversimplification, but not appreciating kind of this whole other aspect of running is, like if you're taught, hey, if you're working with a postpartum runner, you should cue them X, Y, and Z. And like, no, not every, but you wouldn't do that with a normal person anyway. And I think that's the thing where like I do see some pitfalls that the pregnancy postpartum space is falling into that we've kind of already navigated in the running world. Like, queuing to run a certain way, barefoot running shoes. Like we kind of hash this a lot of this stuff, but it's almost like pregnancy postpartum is like, hey, we found this, you should do that. And I'm like, oh God, we're doing this again. Like, really?
Right.
Let me tell you how this ends. Like,
Yes, I really hope that if people are working with runners that they are following really expert running biomechanic
mhm,
experts, Max Paquette, Rich Willie, like
yeah.
they and hear what they have to say about running biomechanics and working with track athletes and cues, because you definitely can confuse runners and have them focus on things that aren't important,
Right.
aren't important.
Yeah, exactly. Exactly.
Or can make them
Um,
lean too much, like
right.
you can't just tell someone to lean. They automatically tell them to lean. Like you need to have seen how they're running, see what's working, what's
Yeah.
struggling with. It's not an automatic thing.
Yeah. No, I'll even occasionally I'll play with things. We've got an alley here out back that I'll do runs with clients on. And sometimes they're like, well, just try and lean in because it's a little bit of an uphill. I'm like, just the tiniest little bit. And they end up like running like I'm like, no, that's not it. We'll always video it because I'm like, you think you're here, but you look ridiculous. Or the other one is when you're trying to kind of navigate, crossover pattern, and then they end up running like they have a full diaper. And I'm like, you know what? Just don't. Like, let's just not do that. Like there's better ways to do this.
Right, right. And some people already have a naturally good, slight wean. They
Right.
don't need to
Yeah.
do it. And so if you tell them, they
Right.
do it more. And it's just like
Yeah.
not always,
Yeah.
not for everyone.
Yeah. But again, it's like I had another person I was DMing with that her provider told her that she should be bracing when she's running. I'm like, on what planet? Like, she's like, I feel, and how the conversation went was she's like, yeah, I was told to brace when I'm running. And I'll remember in the beginning, then I kind of forget to do it. I'm like, do you know why you forget to do it? Because it's not, I'm like, yes, I need you to brace if you're deadlifting, but like running, no, not unless I'm like throwing something at you and have to catch it while you're running. Like,
Right, right. Understanding a dynamic responsive
yeah.
exercise that you can't control. It's important to think of, I mean, there will be cues for sprinters like run upright, but they need to
Mm-hmm.
be relaxed. And if you're telling people to
Right.
muscles or squeeze, like they need to be running relaxed, even when they're running fast and putting a lot of force in the ground, they are running relaxed.
Right.
So definitely, yeah, you can't be cueing these quick.
No, no. And I think, again, that's why I think it's so important to, when you're trying to work through this stuff, there's this added level of understanding. If you are a runner, you are a mover, because when you have those moments of flow or whatever, where you feel like, wow, I'm really running efficiently right now, and you pay attention, it's not work in the sense that you're like overthinking or over gripping or this or that. It's like you feel stable wherever that comes from. You feel like things are turning over freely. You feel like it's a lot of automatic, like things are just kind of clicking. And if you think about efficiency, like you shouldn't have to think about every little thing. Um, and we forget that sometimes. I think people get caught up in, the nuances and the details, and more is better, and I'm like, actually less is better. And maybe that's just me getting older and I don't have as many F's to give, but I'm like,
Yeah.
less is better.
The hard thing is social media drives, you need this big
Mm-hmm.
statement to grab attention. And so people do feel the need to make this one statement applicable to
Yeah.
everybody. It'll stay, I mean, it stands out. And I have this great expert advice. And so I'm
Yeah.
going to make, and so people feel like they've got to come up with these really expert tips that
Yeah.
maybe apply to some people, but really it's really difficult until you have a lot of experience working with a lot of different people to really narrow
Yeah.
down tips, right?
Yeah.
Tips, general tips should be coming from someone who has a wide vast of
Yep.
experience and can be like, generally speaking, working with all these different types,
Right. This
this,
is
but
it.
otherwise,
Yep.
it worked for me, so it
Right.
worked.
No, I know. So bye now. Um,
Right.
okay. So for you, in the last, let's just say 5 years in general, you've worked with a really broad, variety of athletes in different sports. How have your athletes' results sort of changed your perspective on what women can or can't do when they're navigating their sport in pregnancy or postpartum? Like, how has that evolved kind of the longer you've been in this, the more sports you've kind of navigated and worked with?
Um, do you mean like how they've navigated getting back to their sport? Like,
Yeah. I mean, even compared to just like how you approach somebody now versus 5 years ago.
yeah, I think there's a lot. I mean, it's exciting to see there's a lot more confidence
Mm-hmm.
that if they do have some of these issues, we're going to find a way to work with them, help you get back to what you want to do. Sometimes the timeline might be a little longer, but,
Mm-hmm.
you know, there's a lot of women getting back to their sport competitively, performing competitively. It's not a matter of kids don't make you slower, right?
Right.
It's many other factors, and there's still a
Yeah.
lot of left in them to compete
Yeah.
after kids. And so it's really exciting to see them be able to continue their career and not feel like, well, I had kids and everything's done. I mean,
Mm-hmm.
and even the ones that are doing it now, I mean, we have had really great examples. The past 20 years, you know, but there's just
Mm-hmm.
more of them. And then
Yep.
now it's just like, it's just really exciting to see the programming improve,
Mm-hmm.
the rehab improves, they get the right help, they have a lot more resources now.
Yep.
Still a challenge because it's not
Yeah.
standard for everyone and they
Right.
have to seek it out, but at least, you know, social media, for the good reason, is getting more education out there,
Mm-hmm.
and more people are aware of how to work with these athletes and help them. So
Yeah.
it's exciting.
No, just public awareness too. Like it's just the number of face groups that I'm in, and some aren't even like pregnancy postpartum specific, where people will throw out their pregnancy running questions, and there's such a huge community of people with some good answers, and not, you know, you shouldn't be doing, I mean, granted they're in a running Facebook group, but like just so supportive of go get your fifth splint, or go, you know, even go see your pelvic floor PT, which that was not even standardized, you know, and granted, this is just here in the States. This is just, you know, kind of my little corner of the
Yeah.
world. But those sorts of things were unheard of even 5 to 7 years ago. So to see that shift, I think, and again, having more examples um, publicly, just to see that women do have this capacity. There's more in the tank. It's really been cool to kind of come along and watch that, and watch how that we've had to adapt as providers to support them. Um, I mean, even just and I'm spacing on her name, the woman that ran the Boston 5K, that was all over the news, and she
Yeah.
was like 30. Yeah,
Here, right. Yeah. Yeah.
yeah. Like even just 5 years ago, you know, it would all be like shaming, and now it's
Yeah.
like, yeah, there's a little bit in there, but mostly everybody's really positive.
Yeah.
You
A lot
know?
of people are finally realizing that it's okay and they're not hurting their baby. And
Yeah, yeah.
yeah.
There's always going to be those baby shaker people that like, and most of them will, you know, never carry a baby anyway because they're men, but whatever.
Yeah.
Um, that's
Yes.
always going to be there. But like, I feel like the tide has definitely turned. Um, so for you, what are the things, kind of as we wrap up here, what are the things that are making you really excited to work on with clients these days? And where do you kind of see your work changing and shifting moving forward?
Yeah, I'm still really enjoying working with the early postpartum, helping them return to their sport, doing a lot of that. I tell myself I'll maybe put out some courses on working with runners, coaching runners. I definitely feel like there could be an education course out there, but for postpartum coaches working with postpartum runners. But it's difficult. I'm definitely swamped, and so I
Good
have
problem to
these
have.
I want to do, but finding time is really hard. And so, yeah, I'm not sure. I am also coaching still, so I coach spring high school track. I mostly focus on high jump, but then I run a track youth program in the summer. So I love coaching. Um, that's where I love being. Uh, and so it's difficult. I'm not great at social media. I wish I was better at it.
I
But
wish I had you as a coach when I was in
yeah.
high school. I've said this a million times before, every single track coach I ever had was the football coach,
Oh, yeah.
because they needed to like fill out their, you know, their paycheck for that,
Yeah.
you know, time of
Yeah.
year. And I would have loved to have a, a running female track coach. I had an amazing cross country coach that he would bring in women to run with us that he knew, you know,
Yeah.
were great. And he brought in, you know, Nordic skiers and stuff when we were in ski season, and he was
Yeah.
fantastic about that. But yeah, I would have paid good money to have another woman.
Well, it's pretty funny working with high schoolers. High school boys high jump, and getting them to
Hmm.
trust me, right? Like I'm like, all right, but it's a fun time. And
Yeah.
I have really enjoyed doing some like consulting with some sports teams that like
Yeah.
improve our postpartum protocols with our
Yep.
athletes. I would love to do more of that,
Hmm.
and help improve the programming for these sports teams. So that's definitely another thing on my list. So
Yeah. And that's been fun too, to watch the research growing a little bit. more in rugby, more in soccer, kind of, there's a lot more sports, I think, that are, eh, there's more power every time we kind of build these programs and build this understanding. And it's just been really cool to watch that.
Yeah.
For you, just a quick personal check in. How's your running going, knowing that you're kind of navigating your dystonia and all that fun stuff?
It's been a wild ride this past year.
Yeah,
Probably I've dealt with a stress reaction diagnosis, which
that's right.
I'll be honest, I'm not doing enough impact for that, but I'm
Yeah.
getting shin splint diagnosis on MRI, and
Mm.
I'm guessing it's probably going to end up being something like compartment syndrome,
Oh.
because that can show up that way on MRIs.
Mm-hmm.
It's my dystonia leg is the issue, and so
Oh.
I think maybe it's manifesting itself more than it was before. I've always had some off and on calf issues, but it's all
Mm-hmm.
been mostly neurological symptoms, and now it's
Yeah.
a lot of pain. So, um, literally in a boot right now, and I'm hopefully getting out of this boot Friday and doing some more testing. So I'm in a limbo. I
Oh.
trying to figure out my left leg. So it's frustrating because you
Right.
know, I do love running and I'm coaching and I'm trying to
Right.
do stuff. Being in a boot is not fun. So, but at least
No.
bone density is fine. I'm not,
Okay.
that's not the reason. I mean, it's really kind of baffling to be honest, but we'll see. We'll see what ends up.
Yeah. No, it's got to be incredibly frustrating to be like, okay, I'm in this space. I should. And of course, we've all been there. We're like, shouldn't I know how to figure this out? And the fact of the matter is, no, I think we're still on the forefront of like, A, understanding dystonia, two, like understanding, bone stress injuries. Like, we don't know if there's a connection between, like, there's so many things that we still don't understand.
Yeah. And
Um,
dystonia is very rare, and so is compartment syndrome, and
right,
so is artery entrapment, and they do kind of all overlap a little bit. And the testing's not always that great, and you got to seek out these specialists. So it's kind of
right.
exhausting, but I'm like, I'm gonna figure it out.
Yeah. And I mean, I feel like too, like I feel like we need more information as far as, perimenopausal and menopausal women going through this phase and continuing to run because I don't know if you've noticed this, but like it's almost like the generation before us, a lot of them are switching off to like biking and gravel racing and things like that and just saying, hey, I can't run anymore.
Yeah,
And I think ours is kind of that first generation where we're like, okay, we've done enough earlier on that we've diversified and we strengthened and we did these other things.
yeah,
How long can we go? And I think that's when we run into situations like this where this is we don't know this yet, like
right.
we don't know how to navigate this. So congratulations, you're at the tip of the spear yet again.
Yeah, yeah. Back to square one, figuring out what's going on with my left leg,
Oh
but
man,
yeah, I have found joy like doing other things,
that's
volleyball,
good.
golf, that kind of thing. So,
That's
we'll
good.
see. We'll see if my body likes running anymore, but maybe
Love
we'll
it.
figure it out. Maybe we won't.
Stay
So,
tuned, folks. All
yeah.
right. Couple quick questions to wrap up the episode here. In your free time, which you have none, any book you're reading or podcast that you're listening to?
Yeah, I do not read much unless it's research. And I do love listening to podcasts. So I will listen to Women's Health like yours.
Mm-hmm.
And I do like the Physical Performance Show. He talks about a lot of running injuries. I really
Mm-hmm.
enjoy his podcast. I listen to crime podcasts, and music. I'm always listening to music. So
Love it. I have to
that's,
I ebb and flow between whether I want to listen to a person and a podcast or because sometimes I end up running too slow because I'm
yeah.
paying attention too much or whether I just need to put the music on. Who is somebody that you're paying attention to right now? Like either like kind of in running space, any of the sports that you're kind of learning more about, like who's really are you learning a lot from right now?
I really enjoy Margie's research, Christina's
Mm-hmm.
research, with intensity levels in pregnancy. That's really been
Mm-hmm.
exciting. Heart rate, obviously
Yep.
we've known that you can be over 140, but understanding the 90% max maybe
Yep.
isn't as applicable, or at least with high intensity short bouts. That's really really exciting, and we see runners that are doing fine with it.
Yeah.
Themselves. So that's been exciting to see. I love Rita and Shafali's research. I pay close attention to what they're doing, and I'm excited what they're working on. And in the running world, I'm always just following a lot of track coaches and running research biomechanics. So Rich Willie is a favorite.
Yeah, he's great.
Max Paquette's a friend, but I really enjoy his face and knowledge. So just trying to, there's a lot to keep up if you're trying to keep up with regular research and women's health.
We do double duty.
There's a lot.
Yeah. And then finally, any athletes that we should be paying attention to right now that are doing really cool stuff?
Oh gosh. Man, I should be on top of this, but people I've worked with that I follow, but I'm a big fan of Alana Myers-Taylor and what she, bobsled doesn't get as much recognition, but she's been there a long time, and it's not easy to stay at top speed like you have to in bobsleds. They are doing full sprints, and it's a lot of speed and core strength, G-forces. Anyways, for her to be in it as long as she has and be able to sprint competitively still and perform well with bobsled, and she's still going at it. So
I know
that's really exciting to watch for me.
Yeah. We've been working on probably the last year to try and get with her schedule and come on the show. We will get it eventually. But no, I love her. The guy that owns my gym, he and his wife, he was an Olympic bobsledder for some island in the Caribbean. I can't remember. And basically he was like a baseballer that got hurt, and then they pulled him over to do this. And so a lot of the programming that we get is very reflective of that, where you're doing like sprint, power, like those sorts of things. I have so much respect for that. Like it's so cool. It requires a lot. So hopefully we'll get Alana on the podcast. That would be awesome.
Awesome.
All right, my friend. We're gonna finally meet soon. I think this might air after we have met. So we're just gonna, do a little foreshadowing. We met. It was great. No, I'm so excited.
Yes, that's true. So exciting time. So
very cool. Well, thanks so much.
So you do a lot of awareness. You do great posts, like educated posts. It takes a time and effort, and how
it's a labor of love.
You're really good at writing, so that comes through. So it's really helpful to have your
thank you.
Yeah,
that comes from having a dad who was an English teacher and spending my summers looking for Robert Frost and Henry David Thoreau and Emerson and all that kind of stuff. So who knew that could mash up with pelvic floor and running?
It's been so important. It's been really great. So I've really
love it. Well, thank you. No, I appreciate it. But again, like this, if you guys haven't read this paper, I share it as much as I possibly can. Go check out Celeste's 2022 paper, looking at this. And again, feel free to take some of these things and play with them. And it's just been one of the most poignant things that I've been able to play with the last couple of years, and really made some breakthroughs with my clients and reframed how I've thought about things. So thank you for putting this out in the universe and letting us bastardize it and do it with it what we will.
Yay. Yay. Thank you. It's been great.
Awesome. All right, my friend, I will see you soon, and thanks for joining me.
All right, thank you. Goodbye.
If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.